is Erica Croswhite, and I am going to discuss um, social relationships with clients between a therapist and their clients in this presentation. So, in the presentation, we will discuss social relationships with clients during the counseling relationship and after, cultural implications to keep in mind, as well as boundaries to guide feelings of attraction in counseling. So, social relationships during counseling. This is tricky because naturally, as you get to know your clients and they get to know you, there could be a desire to want to do stuff together. And that could be anything from getting coffee to going to a concert to um, forming a social connection. And in general, our text explicitly discusses how becoming socially involved with clients as a therapist is not appropriate. And there's several reasons why, but some of those reasons are that the therapist may not be as challenging in the relationship any longer. They also may become enmeshed with their clients, and they're actually at a greater risk for exploiting their clients, even if it's unintentionally. Um, Also, and unfortunately, blending a social and professional relationship, it can negatively impact the therapeutic process, but it can also compromise the friendship. And so, if you think about how a client comes to a therapist for um, a safe space to disclose their deepest feelings and their difficulties and their hardships, and then you're starting to have coffee with them on a regular basis, that would impact the therapeutic relationship. So, social relationships after counseling also tend to not be recommended. Um, and so, it's actually recommended that therapists avoid that as well. So, even after the termination of the relationship with the client, um, it is still pretty difficult to have a relationship with a former client. And one of the reasons is because of the imbalance of power. And this is tricky as well because the imbalance of power, it can discreetly undermine the relationship, meaning that there is a power differential in the therapy relationship that is um, just part of the therapy dynamic. The client naturally sees the therapist as someone who has expertise or is there to guide them in a way that potentially puts them in a place of power. And even after the relationship is over, or after the therapeutic relationship is over and the counseling sessions have finished, that power differential can still exist and it can still impact the relationship after the fact. Also, it's important that therapists don't use their professional work to build their social network and their social supports. Um, so it's very important that therapists have their own supports and their own networks that are outside of their professional work, which is similar to other professions as well, but I would say therapists are held to a higher standard in that regard. Um, if in fact you do get into a situation where there is a request or someone did ask you for coffee or wanted to see if you wanted to do something, there are factors to consider to guide your decisions. And those factors include who initiated the request and how long is the request for, and what would the activity be, and what is the degree of intimacy. And there's very good examples around if someone asked you for coffee, if someone asked you for a candlelight dinner, if someone wanted you to come to their child's basketball game, or if you were invited to a baby shower. All of those situations seem um, so easygoing on the surface, but can actually impact the relationship or impact the client in a way that they didn't expect. And it's the therapist's job to always protect the client. The cultural implications that therapists need to keep in mind is that for some cultures and for some clients, um, that closeness, that social relationship, that connection that's beyond the professional walls of the therapy session is actually considered in high regard. Um, and in some cultures, doing activities together is part of the therapeutic process. So it's important to recognize those cultural implications when you're working with people who come from different backgrounds than yourself. Also, in some cultures, self disclosing to a stranger may not be valued or acceptable. And so that personal approach might better align with their cultural background. And that's something important to consider because we do want to always honor our clients' cultural backgrounds, expectations, and norms, as well as setting boundaries for what that means in a therapeutic relationship. Also, some clients could expect their counselor to be more than just their therapist, as a social justice advocate or a leader in the community or someone who can have um, important conversations with different leaders or different influencers in the client's life. And so, in that way, there might be an extension of the therapeutic relationship. However, in all of these ways, it is very important that the therapist discloses why the relationship has this additional layer in order to protect the client and remain very self aware in their approach with clients when there are cultural norms that actually call for a closer relationship. Attraction in therapy, very interesting that the textbook talks about 76% of um, therapists over the course of their career have experienced feelings of attraction toward a client. And so, one of the most important things here is that while that might be normal, it is absolutely not okay or acceptable to act on those feelings. You have to monitor your feelings. You have to address any feelings of preoccupation. You have to examine the issue in supervision. You have to absolutely prevent sexual misconduct, and you can't ignore or hide the feelings. But when a client is attracted to a therapist, the therapist is responsible for sharing the ethical guidelines that do not allow romantic relationships with clients. So, talking about that and what we are bound by and the integrity that we uphold. Therapists should refuse to engage in romantic relationships, and they have to clarify the purpose of the therapeutic relationship, that it is not meant to be a romantic relationship, and then discuss options of continuation or referral or termination. So, navigating sexual attraction as a therapist, the text offers some directions, some guidelines, and the first thing is to establish clear boundaries in your personal life. Um, as a therapist, it is very important that we have an awareness and a very mindful approach when it comes to our boundaries within our personal and professional lives. Again, I think we're held at a higher standard. We have to manage any countertransference reactions. We need to acknowledge the feelings of attraction in a safe setting, and we need to deal with our personal feelings as to not burden the client. The ACA Code of Ethics has several guidelines related to romantic and sexual relationships, about how they are prohibited, um, and that if in fact you are interested in a romantic relationship with a client, a minimum of 5 years needs to pass since the last professional contact before any sort of dating would occur. So, sexual contact between a therapist and a client is unethical and morally and ethically wrong. That is what our textbook states. And the potential harm of sexual contact um, is number one, it's illegal in most states. Number two, it exploits the client, which obviously doesn't put the client's needs first. It is considered the highest degree of boundary violation. It can result in suicidal ideation for the client and also negative consequences such as mistrust, isolation, fear, depression, shame, guilt, anger, PTSD, again, suicidal ideation. The harm is very clear and there is no gray here. Sexual contact between a therapist and a client is absolutely not allowed. So my personal takeaways is that um, we do not mix professional and social relationships. We need to clarify boundaries with clients while honoring and respecting the cultural implications of the relationship. We need to consult with trusted colleagues when necessary. We have to address the feelings of attraction with integrity. And consider including boundaries of the therapeutic relationship in the informed consent document. That would offer more protection for both the therapist and the client. And we have to uphold the ethical codes. Thank you very much. And I'll close with the quote, once a client, always a client. And here are my references.